Welcome, welcome everybody. Thank you for joining us. We're just letting people get in as we are getting ready to start our summit, but thank you for being here.
Okay, well, I think we are at 10:01. We have a packed agenda for today. So Karen, would you like to get us started? Oh, and Karen, I think you're muted.
Thank you very much. And can you just confirm you can see me? I just can't see myself. So I just want to confirm you can see my camera. Awesome. Thank you. So good morning, everybody. Welcome to the 2022 Sickle Cell Disease Summit. On behalf of the organizing committee, we warmly welcome you to the 2022 Sickle Cell Summit. This virtual summit is presented by the Sickle Cell Awareness Group of Ontario in partnership with the Hospital for Sick Children, University Health Network, McMaster Children's Hospital, and London Health Sciences Centre. I'm Karen Fleming, co-chair of the summit, a registered nurse, a simulation educator, and the education coordinator for the Sickle Cell Awareness Group of Ontario. And I'm ecstatic to be here.
All right, Karen, thank you for getting us started. Yes. So I'm Dr. Jennifer Bryan. I am the co-chair of the summit, and I'm an emergency physician at the University Health Network in Toronto. This summit is a forum for bringing together global clinicians, people living with sickle cell disease and their families, policymakers, and community advocates to learn about advances in sickle cell disease and to work together to address ongoing challenges.
Our work today is in the spirit of improving care and building community together. We'll begin with a land acknowledgement. We're grateful for the opportunity to gather, though virtually, on this land, and we thank the generations of Indigenous people who have taken care of this land long before other nation groups came. In particular, we acknowledge the traditional territories of the Ojibwe, the Anishinaabe, and the Mississaugas of the New Credit, whose territory is covered by the Upper Canada Treaties. We also recognize the contributions the Métis, Inuit, First Nations, and other Indigenous peoples have made in shaping and strengthening this province and this country as a whole. We also need to continuously educate ourselves about the colonial history of this country and understand how the wrongdoing of the past still impacts the present and the future. We encourage everyone at this session to actively seek information and take action.
We're going to go over some logistics for today. So the sessions will be recorded, so they're made available for your reference, or if you were registered and not able to attend a specific session. If you have any questions, and hopefully you will have questions and comments throughout, please use the Q&A or a chat feature to send your questions to the session moderators. And we're going to go through as many of them as possible during the sessions. Remember to use respectful language in the chat, and please don't post material that's unrelated to the discussion topic at hand. Keeping discussions and comments on topic as much as possible. We're very excited today that we are able to offer interpretation from English to French and French to English. At the bottom of your screen, you're going to see an icon for interpretation. You can go ahead and select your preferred language. And remember that the information shared today does not constitute individualized medical advice and is shared with you for information purposes only. None of the materials shared with you today are intended to substitute the professional medical advice from your own care teams.
The theme of this year's summit is delivering equity in sickle cell disease. It highlights the ongoing need for focus on addressing equity gaps in care of those living with sickle cell disease, particularly in the context of the global COVID-19 pandemic and the changing landscape of healthcare in recent years. The summit features 2 days of presentations and panel discussions on equitable care and treatments for sickle cell disease. Participants in Canada and around the world include healthcare providers, patients, caregivers, health system leaders, health policymakers, government officials, researchers, advocates, and industry partners.
After participating in this two-day program, participants will acquire knowledge in multiple topic areas and have a better understanding of the impact of racism and bias in sickle cell disease and how community members and healthcare providers can address these and other barriers to care together. You'll also have a better understanding of the complications of sickle cell disease, including the impact on mental health. We'll also be going through current therapeutic approaches in sickle cell disease, including cutting-edge curative treatments.
The Sickle Cell Awareness Group of Ontario would like to recognize our partners in making this summit possible. University Health Network, London Health Sciences Centre, McMaster Children's Hospital, and the University of Toronto Temetry School of Medicine's continuing professional development. Thank you.
We also want to acknowledge the Summit Planning Committee members. To put these 2 days together of excellent programming was a shared endeavor by all of the people that you see on this screen, in addition to Ms. Ika Washington, who many of you have been in contact with over these past few weeks in getting access to Zoom and making sure that everything behind the scenes was working well. So we acknowledge everyone who put efforts into making these next 2 days possible. This event is an accredited group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada. It's approved by the Continuing Professional Development Group of the Temetry Faculty of Medicine, University of Toronto. For specialty physicians who are attending these sessions, you may claim a maximum of 7.5 hours of time attended as part of this group learning activity. This program has received financial support from Vertex, Chessie, Pfizer, and GBT in the form of unrestricted educational grants. This program has received in-kind support from Task Off Global Consulting in the form of consultancy support. For potential individual speaker conflicts of interest, speakers will disclose any potential sources of conflict of interest as part of their individual presentations. The sponsors of this program did not influence the Scientific Planning Committee's selection of speakers, panelists, moderators, or topics. Sponsor promotional materials, as you've likely seen, were included in the accompanying ebook and will be included in the summit, consistent with the guidelines of the University of Toronto. At the end of today, this session will be followed by a separate satellite session that will feature representatives from sponsoring organizations.
We also gratefully acknowledge the support of our sponsors. Our gold sponsor, Vertex, our silver sponsor, Chessie, and our bronze sponsors, Pfizer and Global Blood Therapeutics. We'd now like to introduce Ms. Lanre Tunji-Ajayi. Ms. Lanre is the President and CEO of the Sickle Cell Awareness Group of Ontario and she is the founding president and CEO. Her advocacy work has resulted in improved patient access to life-saving and disease-modifying therapies. We welcome you, Ms. Lanre.
Thank you very much, and greetings, everyone. As the President and Chief Executive Officer of the Sickle Cell Awareness Group of Ontario, and on behalf of the Board of Directors, I welcome you to the most talked about summit in town, the Sickle Cell Disease Summit 2022. During the course of the next 2 days, about 500 registered participants from different parts of the world, including healthcare providers, individuals living with sickle cell disease, their caregivers and families, government bureaucrats, elected officials, community advocates, and industry partners will gather through this platform to impact and be impacted about the most common inherited blood disorder in the world, sickle cell disease. Together, We will advance knowledge translation among care providers and improve disease management among families. Now, the theme for this year's summit is delivering equity in sickle cell disease, lessons from the pandemic. Though the most prevalent inherited blood disorder in the world, sickle cell disease does not attract funding or research compared to similar disorders such as hemophilia and cystic fibrosis. Clearly, there is inequity and this must change. There must be improved equity where sickle cell disease is concerned. We cannot afford to continue to lose our young people because of the poor funding trajectory for sickle cell disease. No, we cannot. And that change starts with you and me. We must rise with knowledge and impeccable advocacy skill set in order to improve the sickle cell disease profile and the health outcomes of the families we serve. Through this two-day summit, you will learn how SCAGO has been doing its own part in improving patients' access to equitable care in her province here in Ontario. We also hope that through the many education opportunities presented at this summit, the attending patient organizations, advocates, and clinicians from all over the world will learn a few things that will propel them forward in their work. Now, before I hand it over back to the co-chair of the summit, Dr. Bryan and Ms. Karen, I would like to thank every one of you for making it today. You being here means that you're ready to improve outcomes of patients with sickle cell disease. I would also like to acknowledge our hospital partners, University Health Network, Hospital for Sick Kids, London Health Science Center, and McMaster. And also our sponsors, Vertex, our gold sponsor, TSC, our silver sponsor, Pfizer and GBT, our bronze sponsors. Without these partners and sponsors, this summit would not be possible. Again, I welcome you to Sickle Cell Summit 2022, and thank you.
Thank you so much, Ms. Lanre. It really is setting the tone for these next couple of days. Now we would like to introduce Mr. Lance Archer. Mr. Archer is a member of the Sickle Cell Awareness Group of Ontario's Board of Directors and the chair of the SCAGO Patient Advisory and Advocacy Council. Mr. Archer.
Thank you so much, Dr. Bryan. Welcome to you all who are joining us. In reflecting on the goal of this organization, I kept thinking about the major threat to health equity. And one of the main threats to health equity is assumptions. We assume that one size may fit all. We assume that we may generalize treatment approaches to everyone within the same community because of the condition that they may have. We assume that because a patient doesn't appear to be suffering, that they may not be truly challenged by the complications of sickle cell disease. It is time that we do away with our assumptions. It is time that we allow ourselves to see patients for being individuals who are going through very unique experiences. And that's what health equity is all about, meeting that patient where he or she is. May you leave here today feeling inspired to do whatever is necessary to promote health equity so that the treatment of patients with sickle cell disease in Ontario and across the globe will be optimized. Again, I welcome you to our summit. I hope that this will be an enriching and educational experience for you. Thanks again and welcome.
Thank you so much, Lance, for just really inspiring us. As taking notes already, just around some key words I heard, such as assumptions. And the other thing I really liked that you talked about was individualized and meeting the patient where they're at. So lots of good points. Thank you. I'm now going to hand it over to Ms. Lanre to introduce our plenary session with our Ontario Health team.
Thank you very much. I was muted. Okay, so welcome back to the Sickle Cell Summit 2022, and it is my pleasure to introduce Carol Kennedy-Yi and Gracia Mbaya from Ontario Health. They will deliver the Ontario Health summary of the quality standard in sickle cell disease, and I would like to introduce them. Carol Kennedy has a clinical background in physiotherapy and training in clinical epidemiology. Carol is currently a leader in the Clinical and Quality Standards Program at Ontario Health. In this role, she works with an advisory committee, including people with lived experience, clinicians, researchers, and administrators to develop quality standards that focus on conditions or processes of care where there are large variations in how care is delivered or where there are gaps between the care provided in Ontario and the care that patients should receive. Carol is currently co-leading the development of the quality standard for sickle cell disease. How amazing. We also have Gracia Mbaya here. Gracia Mbaya leads the Clinical and Quality Standard Program within Ontario's Health Clinical Institute and Quality Programs portfolio, co-leading the development of the sickle cell disease quality standards. Gracia has been with Ontario Health for almost 6 years and previously worked as a senior analyst with cancer screening, program design for the Ontario Breast Screening Program. Prior to that, she worked as a research analyst with the Quality Standards Program, formerly part of the of the Health Quality Ontario, HQO. Gracia possesses a Master's of Science in Health Promotion and a Master of Public Health from Western University, and is currently working in her PhD part-time in Business Administration Health Management at the DeGroote School of Business, McMaster University. I would like to welcome both Carol and Gracia to this podium. Thank you.
Ms. Lanre, and I think Kara's joining in as well. Because we are a little bit ahead of time this morning, we are just getting Dr. Yi and Gracia prepared to be joining us in the webinar. So we do have a few moments before we're starting off with their session.
Oh, thank you very much.
Ms. Lanre, I wonder if this might be an opportunity to perhaps talk about some of the current activities at SCAGO, some of the upcoming events, if you'd like to take that opportunity.
Sure, I would be happy to do that in a few minutes. Okay. Wonderful. So thank you again, everyone. And I think being early is always a good thing. So, it means that we are at the top of our game. So at SCAGO, we have a few things that are happening. We've just actually established what we call the Industry Alliance Council. And this council brings about a partnership with individuals living with sickle cell disease, their families, the industry partners, the clinicians and researchers. Because we do believe that we are all a part of a puzzle, the sickle cell puzzle, that we need to really work together, as a team. And so for that purposes, we brought this alliance together that, we should have everybody at a table to discuss what are the needs when it comes to sickle cell disease and how do we, as a part of a puzzle, solve that together. So part of the work that the council will be taking initiative around would be around advocating for things like, registry and also ensuring there are satellite clinics in places where there are not, and so on and so forth. So we're very excited about this opportunity to work together with both clinicians, researchers, and so on and so forth. And I also think that we would have to close this welcome address, and everyone then will have to go to the session for the quality standard, which is where I believe Carol and Gracier and the people who wanted to attend that session will be. So I want to thank everybody again for being part of the welcome address, learning about what we're doing at SCAGO, and we look at you joining us in the next session, which is in about a few minutes, where the Ontario Health will be presenting the quality standard for sickle cell disease. Thank you, everyone, and see you shortly.
Thank you so much, Ms. Lan. So all participants, you guys, we can leave the webinar now, and then in the lobby, you will see the little icon for the Ontario Health session, and you can click on join, and we'll see you there shortly. Thank you again.